it's Amelia from Wonder Birthing, and I just wanted to jump on today and talk to you about the types of questions that you need to ask your care providers. So I have recently written a blog, and it was all about VBACs and how to have a successful VBAC. And really, oh, there goes the clock, good timing. Really, it's all about asking questions and finding out information from your care providers. So, for example, for women that are going for a VBAC, the types of questions you want to be asking is like, what is your successful, message as well, gosh, it's all happening. What is your success rate for a VBAC? What are the actual statistics of women that have vaginal births once they've been in your care, and the percentages? Find that out. If they can't answer you on the spot, then ask them again the next time you see them, or email their midwives that are helping them, because they will know. And I think you'll find that's a very clear indication of how successful your own VBAC is going to be. Obviously, you can never actually quite tell what's going to happen in birth. Birth can be unpredictable, but education, information, and ensuring that you have the right care providers supporting you is really key in making it as a successful and positive experience for you that you can possibly get. So that's in relation to VBACs. And then also, I was just really thinking, like, it doesn't matter what type of birth you're going for. There are a lot of crucial, important questions that you need to ask your care provider so that you feel safe and secure, and that they know how to support you the best way. And so that also you can feel confident that they're going to support you in the way that you actually want to be supported. So questions I was thinking of just before are, if I get to 40 weeks, when do you start talking about or thinking about inductions? What's their sort of induction rate at the practice or at the hospital? What's your induction rate? And what would be the types of things that you would then start, that would be happening to my baby or myself, that you would then start talking to me about an induction? So that's a really important key. I think in Sydney, the induction rate at the moment is about 20%. So that is quite high. And, if you are hoping to go into spontaneous labour, then that type of question is really important so that you understand. And when you get to 38 weeks or 39 weeks and then they start talking about inductions, that you're not surprised and taken off guard, so that you feel prepared. This is, basically the key to any sort of positive birth experience, is having all the knowledge so that you can ask the right type of questions, and so that you can get the information that you need to make informed choices with your care providers. Another example of questions to ask are, do you offer water births? What type of things could interfere with my water birth, or, prevent me from getting in the pool to give birth? So really find out what their sort of policies are, and really get them to understand the type of birth that you want to have. Another really good one is to talk about fetal monitoring. When do they monitor the baby? When do they monitor you? And do they have access to mobile monitoring so that you can still have an active and upright birth? This is really important to, being upright and active. If anyone knows me and follows me, they'll realise that I, get off the beds. That's my big thing. Being laid down on a bed while you're being monitored can actually really interfere with your labour and your birth, and can actually help discourage your baby from moving down so that you can have a vaginal birth. So all that stuff is really, really important. I'd also, ask about the episiotomy rate, ask about their epidural rate, because if they're things that you're not wanting to have in your birth, then it's really key that you understand what the sort of environment that you're walking into and what their policies and statistics are. Okay, so I hope that's given you some ideas. I hope you've written down all those great questions to ask your care providers. Doesn't matter what type of birth you're going for, even if you're having a planned cesarean, make sure you ask, can you have, your cannula and things on your non-dominant arm, so that when your baby comes out, that then you can have skin to skin straight away. Also, with the other monitoring things, can they put the pads and stuff on your back so that you can have your baby on your chest? There's so many things to consider and think about. And if you've got any questions, send me a message, amelia@wonderbirthing.com.au. For my latest blog on VBACs and having a successful VBAC, check out my website or direct message me. I love hearing from pregnant women. So yeah, I've got classes coming up. Check out my website. And yeah, I hope everyone has a great day. Okay, bye.